Health coverage is in the crossfire for 250,000 patients as a contract dispute with Michigan Medicine reaches a breaking point. This is the letter landing in the mailboxes across the state. It warns Blue Cross members if an agreement is not met by June 30th, U of M doctors, hospitals, and services will be cut from the network. For many, this means losing access to critical specialists or facing crippling out-of-pocket costs. 7 News Detroit reporter Tony Geftis spoke with patients caught in the uncertainty and explains exactly what's at risk.
Some patients who have Blue Cross Blue Shield as insurance and rely on Michigan Medicine for care say this dispute is giving them additional stress and anxiety, and that is the last thing they need.
Do you feel trapped in the middle?
Yes. Yeah. That's the frustrating part.
Elena Sullivan has several heart conditions and receives treatment through Michigan Medicine. The 45-year-old who lives in Oxford relies on Blue Cross Blue Shield to cover some hefty bills.
And when you talk about insurance, though, do you know how much it would cost if you had to pay extra, like out of network? Or 40%?
I do know the angiogram last year cost about $45,000.
Who wants to go to the hospital and then find out it wasn't covered?
Wendy Dwyer of Livonia also has a chronic heart condition and travels to Ann Arbor for care.
Like I Google searched long QT and the best doctors in Michigan for long QT, and they're all out of Michigan Medicine.
Both women tell me they're worried their insurance provider, Blue Cross Blue Shield, won't come to an agreement with Michigan Medicine before a deadline of July 1st. That could put their coverage in jeopardy.
Blue Cross is working very hard with our colleagues at Michigan Medicine to come to an agreement.
A spokesperson for Blue Cross Blue Shield explains the company would still provide coverage after July 1st to more than 40,000 patients at Michigan Medicine if they have certain conditions. But that coverage would only last 90 days. According to Michigan Medicine, those conditions may include pregnancy, cancer, transplant surgery, terminal illness, or serious acute or chronic conditions. Meantime, Elena received this email from Blue Cross encouraging her to transfer care out of Michigan Medicine. A spokesperson for Michigan Medicine emailed me in response to Blue Cross's unilateral outreach to members today. We want to be clear that there is no change to patient care or coverage today.
Blue Cross Blue Shield stated in that email the company will continue to provide updates as the two sides work toward that deadline of July 1st. In Detroit, Tony Geftis, 7 News Detroit.